morning, everybody. I didn't say anything yet. But first of all, I want to thank Alexander and Sophia and your team for letting me report on our activities in the MyHealth EU services. Oh, hearing. Anyway, what I'd like to do today is report to you on what we're doing in MyHealth EU and how this corresponds with EHDS, although Aurora has already presented it very nicely, so maybe I'll go into more detail and tell you where we're going and how are we preparing for the EHDS, although that was also very nicely explained by Professor Skizas and by Anderson Cuomo from the Expand EH. MyHealth EU services are functional. It's not a project anymore. It's a functional service which is currently operational, and the services are operational in 11 countries, and we're exchanging medical information, we're exchanging patient summaries and e-prescriptions. This means simple use cases that healthcare professionals in EU country can retrieve a patient summary for a patient which he or she is treating who is from another country, and if that patient summary is available. On the other side, the e-prescription use case, a bit more easy to understand and use, and also that's why we have a higher uptake there, where citizens are able to get their medication in another EU country on the basis of an e-prescription that is given to them or prescribed to them in their home country. I don't know if we, oh, okay, here we go, sorry. All right, this reminds me that I didn't introduce myself. My name is Klara, I come from the Czech Republic. I'm responsible for or coordinator of the Czech National Contact Point, but today I'm representing the MSEG, the eHealth Member State Expert Group, and reporting about our activities. Sometimes and Aurora has explained it, but sometimes I get questions like, hey, EHDS, it's something very new. How will it correspond with your work? And I always tell them, yes, EHDS is in many ways a new thing, but in many ways it's not. It has just happened after pandemic and due to other reasons that the people at the European Commission have said, hey, we've invested already so much money, capacities to the piloting projects such as EPSOS, such as Expand, and there has been enough piloting, enough money invested. Let's do the real thing and let's bring the results of these invested money and the projects to the European citizens and to the healthcare providers, and let's really start delivering the services. Let's learn from what has been piloted already and let's deliver it to everybody. What we're doing right now and how the services work right now is on the slide. It's kind of simplified, but we have the infrastructure provided by the Commission. We have the central services needed provided by the Commission. We know what data we want to exchange. Data is provided by member states. Together, member states and the Commission agree on the rules, specifications on how are we going to exchange, and the services are operated. That's how it works, very simplified ways right now. We have the eHealth network, which is the policy owner. Representatives of the member states approve the rules, approve on how the services will be run, approve or take a decision on admitting countries which fulfill those rules and which are trustworthy and can exchange information. On the other side, we have as I said, infrastructure provided by the Commission. We have under it the MSEG, which are representatives of the NCPs, such as myself, who are the people who are really implementing the rules and specifications agreed upon between the Commission and the representatives of the member states. But we can't do it alone. We have many work groups and communities, you see them under there. We have technical, semantic, legal, and other work groups which work together very, very intensively to provide kind of the frameworks for the exchange, because probably most of you, or all of you know that this is really not a simple discipline. On the contrary, very difficult one. So this is what works right now. This is a picture that not myself, but together with Peter, my colleague, we have put together, I think, 1 or 1.5 years ago. And it changes. It kind of shows the uptake of the member states who are entering into operation, who are able to exchange some information according to those rules we have together with the Commission agreed upon. I have to say from my position, and I know many of the colleagues will agree with me, that it's not easy. It's really not easy. It's not easy to enter into operation to fulfill all those rules, but that's only a part of it. It's not easy to prepare the national infrastructure for these services. Aurora had that one nice slide where you had the frameworks, and we have to prepare legal framework, infrastructure, data quality, and capacity building. Half of it is okay, we can do it. We have the experience, legal, organizational, not easy. Those of you who are involved in legislative processes know it's not easy, but it's possible. Organizational also. Infrastructure we have on the European level, most member states have on the national level. Data quality, that's our biggest problem. That's the biggest problem that we have currently, having data in such quality that we can are able to exchange it according to the rules and specifications that we have, and capacity building. There are only a few of us. I can assure you, and it sometimes looks like there are so many projects, so many initiatives. But if you take MyHealth EU services, the Expand EH project, the Prepared EHR XT project, and all the projects before, I guarantee you that 95, maybe 98% of the people are the same. It's the same people again and again, and it's a good thing because those projects are working for us, for the operations. So we're preparing new rules, evolving, but it's really very consistent. So this is how we're kind of if you see the Greek and the Cyprus flags, that's where we are right now. As Professor Skizas said, Cyprus and Greece are about to enter operation. And then you see 23, 24, 25. We don't know what will happen in 25. We know that probably EHDS will come into operation. We're not yet sure how the transformation will take place. From the beginning, we are communicating with the Commission, and our, let's say, main concern, but that concern is being reflected, is that with the coming of EHDS, we can't stop this operation. This is really operation which is taking place, and we can't say, okay, let's stop doing what we have been doing right now and let's start EHDS. It will not work that way. We need to have a very smooth transition where these operations will kind of transform into the new environment, into the new environment, new world. So those services which you see in the center will still be becoming operational. Right now we have the eHealth network, the MSAG communities, which will cease to exist, we know that already, but they will transform in that new environment into the EHDS board, into a steering group or groups. It will depend on how the final wording of the EHDS will look like. But again, this will be the same people working on the same job. We will just need to kind of transform ourselves and shift ourselves into the new environment with the support and help of those initiatives, of those projects, such as were presented by Professor Skizas and by Anderson, who will help us shift ourselves kind of to a higher gear, which will be, or should be, hopefully, much better for everybody. Of course, we have a Commission and DG Sante and the member states and their national infrastructures, which are kind of on the border, functional in the current environment, but of course will be moving into the EHDS world as well. So my message is that what is being right now, what is being performed is functional. It's a partial basis of the EHDS. We're preparing with the help of the Commission, of member state experts and with the help of the initiatives to move into the new environment, to the new world for the benefit of everybody. But we can't be forgetting about what is being functional, and we have to make the transition as smooth as possible. That's it. Thank you very much.